Hello everyone and welcome to NEET Mentor. In this video, we are going to talk about MDMS versus DNB versus diploma, comparison from different perspective and the passing percentage. Okay, and we will also look at passing percentage branch wise. Okay, and different disadvantage of DNB and why we choose MDMS over DNB and how you can plan about the backup option or alternative option and when you should go for diploma. Okay, so if you're new to the channel, you can subscribe the channel, and in the description of the channel you will find a telegram group link which you can join. Already more than 15,000 candidates are there, which will increase gradually as we progress near to the examination. So when you are giving your GTs, getting your score, and accordingly, based on the score, if you are not feeling confident that you will get MDMS in your dream branch, then you can go for DNB also. Okay, so major difference is these are the major difference. MDMS is well recognized socially and is kind of like brand. Everybody knows, even layman knows, like MD doctor, MS doctor to go for. Whereas DNB can be an alternate option when you don't get MDMS. Then you can go for DNB in good institutes. In MDMS, entry is difficult because you need to have better rank. Okay, whereas in DNB, entry is comparatively easier. In MDMS, exit, that is the final exam passing, is easy. Okay, because uh, you will have internal, and in case of DNB, your external exam can be in any city which gets conducted by NB, and it will be difficult to pass. I will tell you the passing percentage also. So exit is tough in DNB. Social level recognition of MDMS, already mentioned, is more popular in India than DNB. Recognition since 2020 is not a big problem in DNB. It's also equally recognized, and as the time progresses, you won't find any issue in case of recognition. The counseling is happening at the same platform, MCC. Earlier it was conducted by NB on different platform. In job, you will definitely get preference in case you have MD or MS degree, whereas in DNB you need to compete with those who are already having MD. Good patient load and clinical exposure, procedural process you will get in MDMS, because you get government colleges. There is the number of patient is lot, and there is no limitation that a experienced doctor only should treat the patient. Whereas in DNB, mostly big hospitals, corporate hospitals, you will get limitations, except in those government hospitals and district hospitals. You will get limitation that since they are paying a huge amount for the treatment, they expect only specialized doctors to treat the patients. So you get limited clinical exposure, but it's not always true. There are government hospitals where it's better clinical exposure, hands-on cutting chances than medical college. There is a bond in MDMS. Some states have 3 years bond. Some states have 3 years compulsory bond, rural service 2 years, 1 year, and in case you don't want to serve the bond, then you have to pay huge amount of penalty. Whereas in DNB there is no bond. That's big part advantage. In case you had to travel to southern part of India, or from if you're from south, then you have to travel to northern part. After completing 3 years of MDMS course, if you undergo 2 or 3 years of service there, so you staying there 5 to 6 years. Whereas in DNB, you can immediately come back to your home city and you can start your practice over there. passing is 100% in MDMS, whereas in DNB it's not 100%. There is no extra SRship is required, but as per the norms, in case you complete DNB from a hospital which is less than 500 bedded, then you need 1 year additional SRship to achieve the equivalent of MDMS. Okay, in case you have done it from more than 500 bedded hospital, then you don't need SRship. So these are the differences. I hope you understand what are the benefits of DNB and what are the benefits of MDMS. The report card of passing percentage shows that gradually the passing percentage has in more the subjects has reduced. The reason is obvious. First reason, the candidates with low score is also getting admission now in DNB and diploma courses. You see the stray vacancy round and a specialist stray vacancy round, just qualified candidate got diploma seats. Okay, who qualified just in category, those also got diploma seats. So the merit of candidate comes into picture, whereas in case of MDMS they are having at least 20,000 rank, 20 to 25,000 rank. But in case of DNB, candidates having rank of 45,000 also they get admission. So the passing percentage will definitely degrade. Second thing, there are hospitals with less number of beds, less clinical exposure, less patient flow. Okay, but in case of government college, all the hospitals associated with the government college will have good patient flow. Okay, so there also you get less opportunity to learn the things practically, theoretically. Okay, there are new hospitals, there the academics is poor. Okay, so these are the factors which are leading towards low passing percentage. Orthopedics, the passing percentage is quite low. In the June 21, it was just 18% candidates got passed, which constantly going down. In case of but if you see on the other side, like general medicine and general surgery, radio diagnosis, ophthalmology, these are having like good passing percentage. Okay, in pediatrics also the passing percentage is below 50% from last 3 examinations. Okay, so that's a concern, but it depends on your like how well you do. In case you don't focus on preparation and have a mindset that in case of low score also you will get admission in DNB and diploma, the same mindset will continue in your PG, and there also you don't study, then definitely you will fail to qualify in first attempt. What stops candidate taking DNB? First, the tag of MDMS, brand, passing percentage, and stipend. Stipend is also less in DNB hospitals compared to MDMS, where in MDMS you have a stipend around 45 to more than a lakh in Delhi institutes and government central institutes. The stipend is so high, whereas in case of DNB you get a stipend between like 35, 45, 50, maximum 60. Okay, so that's also a factor. What candidates should do? So you must keep DNB as an alternative option. Okay, all the DNB hospitals are not having poor passing percentage or the poor patient load. They can be better than a government college. Okay, so you can keep it as a backup in case you don't want to waste a more year. And in case you are failing to get the dream branch, then also you can choose DNB option. In case of private practice, both DNB and MDMS, there's no much difference. If you want to go for super specialization, then DNB will be better option, because when the DNB started, it started with the intention to improve the quality of doctors, quality of medical education, and those who had done MDMS, they used to go for DNB. Okay, but now it came on a different platform. Choose government hospitals or established big hospitals. Avoid going for corporate hospitals, and choosing hospitals in major cities, metro cities is a good option. You need to look at the academic part also, and your decision whether you want to go for TNB or not, it should be clear depending on the rank. Okay, when you enter into the counseling phase, you have a clear mindset that okay, I can opt for DNB for particular subjects also, which candidates usually do, that they don't want to go for DNB in particular subject, but in other subjects like higher clinical subjects, they go for DNB as well. Coming to diploma part, is kind of alternative option if you want to get settled early in less time. There are candidates who have like 5 to 10 years of gap after MBBS. They have family and they want to get settled uh, as early as possible. Then diploma is good option. You can have decent money also, because MDMS would be mandatorily required if you are going to handle the emergency cases, but it's just OPD. Then and if you're charging less, then you can have a good setup there. Limitation is there in metro cities and high profile jobs. Okay, but you can have good practice in semi-urban cities, and you can also go for secondary DNB in case you feel like you need to have a degree course. Okay, so the options are open, and the entry is very easy in case of diploma. We have seen just qualified candidates are also getting clinical subjects in diploma, in NB diploma. Okay, so these are the different aspects of MBDMS, DNB, and diploma. Hope the video helps you, and if it helped, then you can like it and you can share with your colleagues, friends. So thanks for watching. Have a nice day.